Welcome to Health and Tech, the podcast where we break down how technology is transforming the healthcare industry. I'm your host, your name, and today we're going to explore a fascinating topic, health informatics. Health informatics sits at the heart of modern healthcare, merging technology with clinical practices to enhance patient outcomes. In this episode, we will explore the DIKW model, the concept of health informatics, the evolution of IT in nursing, telemedicine, mHealth, data privacy principles, and the practical applications of IT in healthcare. Stay tuned for a detailed discussion that will unravel the complex yet exciting world of health informatics. Segment 1. The DIKW model, data, information, knowledge, wisdom, 6 to 8 minutes. Host. Let's begin with the DIKW model, a fundamental concept in health informatics. DIKW stands for data, information, knowledge, and wisdom. This model is often referred to as the knowledge hierarchy or the information hierarchy, and it serves to help us understand the transformation of raw data into meaningful and actionable wisdom. Data. At the base of the hierarchy is data. Data consists of raw, unprocessed facts and figures. For example, if you think about a patient's medical record, data could be a single entry like a blood pressure reading of 140/90. While this piece of data is factual, it doesn't have much meaning on its own. In the context of healthcare, data could be anything from temperature readings, lab results, or the number of steps a patient takes per day. Without interpretation, data is just a collection of symbols or numbers. Information. Moving up the pyramid, we reach information. Information is what you get when data is processed and organized in a way that gives it meaning. Continuing our example of the blood pressure reading, if we know that the patient has consistently high readings over a period of time, this becomes information. Information answers basic questions such as who, what, when, and how many. It starts to provide some insight but still lacks context. Knowledge. Next, we have knowledge. Knowledge is derived from interpreting information within a specific context. In health informatics, this means understanding the significance of information. So, if our patient has a blood pressure reading of 140/90 and we understand that this level of pressure is indicative of hypertension, we're now dealing with knowledge. Knowledge allows healthcare providers to develop care plans or treatment strategies based on what the data and information reveal. Wisdom. At the top of the pyramid is wisdom, which is the ultimate goal of the DIKW model. Wisdom is the application of knowledge through experience and judgment. In healthcare, wisdom is where decision-making happens. The clinician uses their knowledge about hypertension to manage the patient's treatment, perhaps by prescribing medication or recommending lifestyle changes. Wisdom adds the layer of judgment and experience, helping clinicians make decisions that are in the best interest of the patient. The DIKW model is essential in health informatics because it illustrates the journey from raw data to actionable decisions. In the context of nursing and healthcare, this model ensures that professionals can use data-driven insights to improve patient care and outcomes. Segment 2. The concept of health informatics, 8 to 10 minutes. Host. Now that we understand the DIKW model, let's move on to the concept of health informatics itself. Health informatics is a multidisciplinary field that combines information technology, IT, healthcare, and computer science to enhance the management of health information. According to the World Health Organization, WHO, health informatics involves the use of technology to collect, process, store, and exchange health data in a way that benefits patient care and healthcare outcomes. In essence, it is the use of IT solutions to manage health information effectively, ensuring that data is available to the right people at the right time. Health informatics includes a broad range of applications, from electronic health records, EHRs, to telemedicine and mobile health, mHealth. It's not just about managing patient records. It's about using data analytics, decision support systems, and even artificial intelligence, AI, to improve clinical workflows and patient outcomes. Why is health informatics important? The development of health informatics has revolutionized healthcare by improving how information is accessed and used. For instance, clinicians can now retrieve patient data more quickly, enhancing the speed and accuracy of diagnoses and treatment decisions. The shift from paper-based systems to electronic records has reduced errors, improved patient safety, and made healthcare more efficient. Furthermore, health informatics also supports evidence-based practice, meaning that care is guided by the latest and most accurate medical research. With the integration of clinical decision support systems, healthcare providers are able to make better, more informed decisions about patient care. This concept is vital for modern healthcare delivery, especially when considering the complexity of today's medical landscape, where the volume of data is immense and the need for accuracy and efficiency is greater than ever. Segment 3. Development and Impact of Information Technology in Nursing and Healthcare, 10 to 12 minutes. Host. Let's now dive into the development and impact of information technology (IT) in nursing and healthcare. The use of IT in healthcare is not new. It began decades ago, and the transformation has been steady and profound. History of IT in healthcare. Back in the 1960s, computers were introduced into healthcare settings, but they were mostly used for administrative tasks like accounting and billing. Over time, the role of IT expanded, and by the 1980s and 1990s, hospitals began to develop computer-based information systems to support clinical workflows. This included the introduction of computerized physician order entry, CPOE, systems, and electronic medical records. Today, health IT encompasses much more than just administrative functions. It is integrated into every aspect of care, from patient registration to monitoring vital signs in intensive care units. Impact on nursing. For nurses, IT has dramatically changed how they work. The transition from paper charts to electronic health records, EHRs, has allowed nurses to spend less time on documentation and more time on patient care. The accessibility of patient data across multiple healthcare providers means that care is better coordinated, reducing the risk of errors and ensuring continuity of care. In addition, IT tools like clinical decision support systems, CDSS, offer nurses real-time guidance, helping them to make informed decisions quickly. These systems can alert nurses to potential drug interactions, remind them about best practices, or provide quick access to patient history. Challenges and benefits. Despite the many benefits, integrating IT into nursing has not been without its challenges. Nurses have had to adapt to new technologies, and the transition from paper to digital systems wasn't always smooth. However, the long-term benefits are clear. Increased efficiency, better patient outcomes, improved data accuracy, and enhanced communication among healthcare teams. Segment 4. The development of telemedicine and mHealth in eHealth, 10 to 12 minutes. Host. Now, let's talk about the development of telemedicine and mHealth as part of the broader eHealth movement. As technology has evolved, so has the way healthcare services are delivered. Telemedicine and mHealth are two key components of this digital transformation. Telemedicine. Telemedicine is the use of communication technology to provide healthcare services remotely. Originally developed to serve rural populations and areas with limited access to healthcare, telemedicine has expanded significantly, especially in the wake of the COVID-19 pandemic. With telemedicine, patients can consult with doctors, receive diagnoses, and even get prescriptions without ever stepping into a hospital or clinic. There are different forms of telemedicine, including real-time consultations, where a patient speaks with a healthcare provider via video conferencing. Store and forward telemedicine, which allows healthcare providers to share patient data, such as X-rays or lab results, with specialists who can review it and provide feedback later. mHealth. mHealth, or mobile health, refers to the use of mobile devices such as smartphones and tablets to provide health services and information. mHealth has become particularly popular for managing chronic diseases like diabetes, hypertension, and asthma, where regular monitoring and communication with healthcare providers are crucial. Mobile apps now allow patients to track their health metrics, such as blood sugar levels or heart rate, and share that data with their doctors in real time. In developing countries, mHealth has been a game changer, helping to provide health education, disease surveillance, and remote consultations in areas with limited healthcare infrastructure. e-health. Both telemedicine and mHealth fall under the broader umbrella of e-health, which the WHO defines as the use of information and communication technologies, ICTs, for health services. E-health aims to improve healthcare access, quality, and efficiency. It covers a range of applications, from electronic health records to online health education tools. The development of telemedicine and mHealth has made healthcare more accessible, especially for patients in remote or underserved areas. It has also improved chronic disease management and reduced the burden on healthcare facilities, offering a more flexible and patient-centered approach to care. Segment 5. Data Privacy and Confidentiality in Health Informatics. 8 to 10 minutes. Host. One of the most critical topics in health informatics is data privacy and confidentiality. As healthcare moves towards digital platforms, the protection of patient data has become more important than ever. Why is data privacy important? In healthcare, personal data includes sensitive information like medical history, lab results, diagnoses, and even genetic information. This data is incredibly valuable not just to healthcare providers but also to malicious actors. Any breach in data privacy can lead to serious consequences for patients, including identity theft, discrimination, and financial loss. Key principles of data privacy and confidentiality. Purpose and manner of data collection. Data should be collected for a specific, legitimate purpose. For example, a healthcare provider should only collect the information needed to diagnose or treat a patient. Additionally, the data collection process should be transparent to the patient. Data accuracy and retention. Healthcare organizations must ensure that the data they collect is accurate and up to date. Moreover, personal data should not be kept longer than necessary. Data security. The security of health data is paramount. This means implementing strong encryption methods, secure passwords, and access controls to ensure that only authorized personnel can view sensitive patient information. Transparency and access to data. Patients should be informed about how their data is being used and should have access to their own health records. This transparency builds trust between patients and healthcare providers. Challenges with data privacy. With the increasing use of cloud storage, mobile health apps, and telemedicine, the risk of data breaches has also risen. Healthcare organizations need to invest in robust cybersecurity measures to protect patient data from hackers or unintended leaks. Segment 6. IT applications in healthcare. 10 to 12 minutes. Host. Finally, let's discuss the practical use of IT applications in healthcare. Information technology plays a vital role in almost every aspect of healthcare today, improving patient care, enhancing workflows, and making healthcare more efficient. Electronic health records, EHRs. The most common IT application in healthcare is the electronic health record, EHR. EHRs provide a digital version of a patient's medical history, including diagnoses, medications, treatment plans, immunization records, and test results. They allow for more efficient and accurate record keeping and make patient information readily accessible to authorized healthcare providers. EHRs reduce errors related to handwriting and improve the overall efficiency of the healthcare system. They also make it easier for healthcare teams to collaborate, particularly when a patient is seeing multiple specialists. Clinical Decision Support Systems, CDSS. CDSS is another significant IT application in healthcare. These systems provide real-time assistance to clinicians by offering evidence-based recommendations. For instance, if a doctor is prescribing medication, the CDSS might alert them to potential drug interactions or remind them of best practices for a specific condition. These systems improve the accuracy of diagnoses and treatment plans, ultimately enhancing patient outcomes. Telehealth platforms. As mentioned earlier, telehealth has revolutionized patient care by making it easier for patients to consult with doctors remotely. Telehealth platforms enable video consultations, digital diagnostics, and remote patient monitoring. Wearable technology and IoT. Wearable technology like fitness trackers and IoT-enabled medical devices are becoming more prevalent. These devices can monitor vital signs like heart rate, oxygen levels, and blood pressure, providing real-time data to healthcare providers. This has made it easier to manage chronic conditions and detect potential health issues before they become critical. Conclusion: 2 to 3 minutes. Host: that brings us to the end of today's episode. We've explored the DIKW model, the concept of health informatics, the development and impact of IT in nursing and healthcare, telemedicine and mHealth, data privacy, and the use of IT applications in healthcare. The integration of technology into healthcare is reshaping how we deliver care, improving efficiency, and enhancing patient outcomes. But as we've discussed, it also comes with challenges, particularly around data privacy and cybersecurity. Thank you for tuning in to Health and Tech. If you found this episode informative, don't forget to subscribe and share it with others who are interested in the future of healthcare. Stay tuned for more insights on how technology is transforming the world of healthcare. Until next time, stay informed and stay healthy.